All right, so this is Sherry. Sherry has she came to me, I'm in South Florida, and she drives from Georgia, which is how many hours away?
5.5.
5.5 hours, because she has failed everything. And she has been a chiropractor, physical therapist, right?
Pain management,
orthopedic doctors. And when I met her, I said, this should take about 5 weeks. And the reason why is because, what she has doesn't really show up on an x-ray or an MRI. And the reason why is because there's an alignment issue. So when I met her, she couldn't even really walk, right? You were kind of hobbling in here.
Exactly.
And I had her stand back, and about here, she was like, like she was in so much pain, right? So people, and it's usually women 9-to-1 over men. They come in here, they have the same story. They failed literally everything. And the issue is what's called, I call it the trifecta, SI joint dysfunction, sacral torsion, and sacral shear. And what happens is that her tailbone, so go ahead and extend back. So right now, so when I met her, one of her SI joints was out of alignment. So when I had her do an extension, one side went up like this. I pulled it back down, we stabilized that, that's fine now. You're in alignment right now. What she's feeling, go ahead and point to me where it hurts.
Right here.
So if you look at where she's pointing right here, she's pointing down near her tailbone or at the base of her spine too. And what that is a sacral torsion and a sacral shear. And the sacral shear is caused by the torsion. So go ahead and lay on your belly for me, please. All right, so now let's see here. So what I do is I put my thumbs, okay, right on the sides of her sacrum, okay, and then I tell them, keep your butt relaxed, which is kind of strange. Keep your butt relaxed and press up like a cobra. So you remember how we do that? Just like that, and then down, and then do it one more time. So it can be kind of subtle, so I'm looking for what's happening to my thumbs, okay? So what's happening is I feel my right thumb go down like that, my left thumb come out. So that means that she has a sacral torsion, okay? So what I'm gonna do is I'm gonna rotate her this way. Did that hurt when you did that?
It hurt a little bit.
Yeah, so press up and tell me at what point it starts to hurt.
Right about there.
Right there, okay? So what I'm gonna do is I'm gonna take her tailbone like this and press on the left inferior lateral angle, and I'm gonna push it down this way to re-rotate it, and we'll see if we can get her full extension. So you can kind of feel it. It's kind of like molasses. It kind of like starts to move a little bit. Is that okay?
Mm-hmm.
So on her first visit, I got her, remember I got you full extension, right? We've been at this 2 weeks or so, right? Yes. And I had her full extension. She actually started crying because she couldn't believe, that this was the issue, Because people like her have the same story. Now press up for me.
Oh, much better.
Much better?
Oh, much better.
All right, stand up, please.
Much better. It doesn't hurt as bad.
Is it still there?
Yeah, but it's from being out.
Yeah. Now go ahead and come on over here.
See, it don't hurt to walk.
There you go. And now face this way. And now extend back for me. So now she has full extension, just like that. So the issue was her tailbone rotated, okay? She had what's called a right on right sacral torsion, so I realigned it this way, okay? And then we're strengthening the left piriformis to lock it down. It takes 5 weeks.